Welcome back, Decatur. We're so glad you've joined us today. We've got a lot to discuss this morning. Last week, Governor Kay Ivey extended the Safer at Home order until Friday, December the 11th at 5 p.m. With the holiday season coming up, now is the time for us to begin thinking about how we'll create safe, new traditions for celebrating this year. Today, we are joined by our honored guest. We have with us Decatur Morgan Hospital Chief Nursing Officer Anita Walden, and we're expecting Chairman Long to join us here shortly with the Morgan County Commission. Let me give you a few updates as it relates to COVID-19 in Morgan County. We have 4,695 confirmed cases, which is a 7.44 weekly case increase. As of today, we remain a high-risk county on the Alabama Department of Health risk dashboard. As we prepare for this holidays, our families are all beginning to discuss Thanksgiving plans. With the cases still on the rise, it's important that we enter the holiday season with great care and planning. We've uploaded a full list of COVID-19 holiday tips to the homepage of the city website, which has a new web page name, cityofdecatur.al.com. Again, that's cityofdecatur.al.com. Now, just a reminder that City Hall will be closed on Wednesday, November the 11th, in observance of Veterans Day. Please know that garbage and recycling schedules will be impacted. All routes beginning Wednesday will run one day late. So Thursday's route will be picked up on Friday, and Fridays will run on Monday. As always, we want to encourage you to contact your neighbors, especially the elderly. With the holidays approaching, consider baking a favorite dish and leaving it with a neighbor. I know they would appreciate that. So, Nita, I'd love to get an update from the hospital. Thank you for joining us today.
Oh, absolutely. I'm glad to be here. As always, we appreciate the City of Decatur and Morgan County. They have continued to support us at the hospital, bringing food and giving thanks to our employees. And I can tell you, in this long journey that we've been on with COVID, that's much appreciated. Healthcare workers are weary, as are a lot of people. So keep those thanks coming. We tell them often how much we appreciate them, but they need to hear it from all of our community. Today at the hospital, we have 29 positive patients. We have 2 presumptives. And if you will notice, over the last several weeks, we have less and less presumptives, but it's because our testing is better. We got a rapid test at the hospital, so we're able to do our own. We have 9 positive patients in our ICU. 7 of those are on the ventilator. Our average age of these patients is 67, the oldest being 92 and the youngest 40. So a large range of patients there. We've had 7 positives over the last 24 hours. This has taken a toll on our staff, as I've said. Not only are they weary, but some are testing positive as well. There's a lot of community positives, and so a lot of that's coming from there. A lot of people getting it from their children. We've got 16 positive employees out today, and we have 26 in quarantine. As we've already heard from Mayor Bolden, we've got well over 4,000 positive cases in the county and about 40 deaths. I wanted to give some statewide statistics. Now, you can look up for this for yourself on the ADPH dashboard. But about 49% of the positive patients required ICU care. And of those that required ICU care, about 40% of those required a ventilator. That really taxes our ICU beds throughout the state. And so it really, and it's really had a huge impact on us at the hospital. We have 19 ICU beds. And of those, as I said, 9 of those are filled with COVID patients that we wouldn't have otherwise, most likely. That causes a backup in our emergency department. And so we do have to hold patients there until there are beds made available. Again, throughout the state, we've had over 11,000 healthcare workers affected by this, which affects our own hospital as well. Slightly more females have tested positive than males. However, slightly more males have died than females. The age group most often positive is 25 to 49 years old. And the death age by far is those greater than 65. About 77% of the deaths are over 65. So I caution everyone, we all are weary of COVID. We're ready to get back to whatever normal life was before all this happened, but we're not done. We still have to have vigilance in wearing our masks and distancing as much as possible. And that's hard. That's very difficult. But it only takes someone in your family being positive and you're exposed. And most likely will contract COVID as well. So please be careful. And as the holidays are coming up, be careful. Keep your distance as much as you can. And again, wear a mask. Thank you.
Thank you, Anita. The Parkway campus, the new unit there, is it taking?
We are very close. We will have a soft opening, we hope, if nothing happens, in about 2 weeks. Okay. We have all but one of the employees hired to do the initial opening, and so they're in orientation.
Okay.
And those who are not in orientation this week will start on Monday, and these are seasoned or experienced employees, so they won't need a whole lot of orientation, but they need to know how our system works, our medical record works, and we should be good to go. And that should really help alleviate the number of COVID patients that are taking up hospital beds at the main campus.
At Decatur Morgan.
Yes.
Right. Good.
Yeah, we're excited about that.
Well, we are too. I was just looking at the dashboard for today. We have 41 positive cases today. So we know that the virus is very contagious. Continue distancing, masking, doing all the things that the governor and other healthcare officials have asked us to do. We will have our next press conference Monday, November the 16th, 1 hour later. We'll meet at 11 o'clock following our city council meeting. I want to remind you that we'll have our first city council work session tonight with our new administration. We're excited about that. And you can join us via our YouTube network. So do we have any questions? Okay. Well, very good. Thank you for joining us today, and we look forward to seeing you tonight. Thank you.